Hi there, this is the Public Health Internship Orientation video for Spring 2024 undergraduate internships. It's being presented in the fall of 2023, so let's get started. Note that this video is narrated, so adjust your sound as needed, and you can also watch this with closed captioning available through YouTube and also available on our Public Health webpage. Let me introduce myself. My name is Dr. Laura Gronwald. I'm a senior lecturer and the internship instructor and director here for undergraduate internships in MEZCOPH. I use the pronouns she, her. And you can see my email address right here, laurag1@uarizona.edu, if you need to get in touch with me. So I'll be guiding you through your internship experience and providing support as you are searching, and if you have questions when you're presenting your paperwork or submitting that to our D2L site, and really just excited to work with you. Students have such a great experience with their internships. Every semester at the end, students say, this was my favorite thing that I did. Sometimes students get jobs that come out of their internships. So it's really an exciting opportunity for you to take all that you've been learning in the class and apply it in an internship agency to do real world public health work. So I'm excited for you, and let me share just a bit more information about myself. I've worked on both sides of the academic and internship equation. So I have been an educator for 20 years, both in college and community settings. I have supported students in this internship class and in the past in a civic engagement class. And then I also worked at Ben's Bells Project as the director of education, where I hosted interns from the U of A. So I know what it feels like to be the instructor. I know what it feels like to be the site supervisor. So here to help, with any communication or any questions that come up around any of those things. I just really like supporting students in the community settings. We have such a great community in Tucson. If you're an online student, you can find ways to get engaged with your local communities. If you are a main campus student in Tucson, but you want to get involved in something that's in a different location, lots of students do that too. So a lot of opportunities for you ahead. I'd like to read our land acknowledgement statement as well to just get us started with this video. We respectfully acknowledge the University of Arizona is on the land and territories of indigenous peoples. Today, Arizona is home to 22 federally recognized tribes, with Tucson being home to the O'odham and the Yaqui. Committed to diversity and inclusion, the university strives to build sustainable relationships with sovereign Native nations and indigenous communities through education offerings, partnerships, and community service. So this is what we're going to cover in this video, and I'll try and go through this pretty quickly and efficiently. What counts as a public health internship, the hours you need to complete, how to find and secure an internship, and the forms that you'll need to submit in order to get enrolled. So students cannot enroll themselves for internship units in HPS 493. You need to submit forms first. So I'll go over all that and more. There is an accompanying worksheet. So if you don't already have this on your computer open while you're watching this video, pause the video now and find this on our public health website under undergraduate internships, because you're going to want to answer these questions as we're going through the worksheet. You'll need to submit this to me via email at the end. Okay, so you've got your worksheet. We're ready to get going with our next steps. So first I want you to take a moment to ask yourself, what is public health? And go ahead and pause this video and jot down your answer to that. Okay, so when we're talking about public health, it's really important that we all have our own definition, because you're going to need to talk about that on your orientation worksheet, also on your work plan, and you may need to talk about it when you're pursuing your internship as well. So when I think about public health, I think about not just the science, but the art of preventing disease, promoting health, and protecting people and prolonging life, and looking at populations, not just individual cases. So we do focus on the 4 P's of public health at the bottom of the slide here: prevention, promotion, protection, and population. You've talked about all these ideas in your classes that are preparing you well to get ready to do your internship, But you just want to think about which areas are the most interesting to you in terms of finding an internship and then in terms of finding future work as well. So take a look at some of the words in this word cloud that might help you think about where you are headed and the kinds of searches you want to do when you're looking for an internship. So the internship does need to be public health focused. It cannot be clinical focused. So these are the areas that you have studied in your classes. These are all areas where you can find an internship that will be a really successful launch pad for your future career or your future graduate school experience. So when you are looking at an internship, if you find it on the hub, then you know it's going to be public health focused. But if you're looking on your own, you need to ask yourself, is there a clear connection to public health with this internship? So if you cannot answer yes, then it's probably not going to be a good internship to fulfill your required internship units. It might be a volunteering experience that you find fulfilling, but you do need it to be public health focused for it to count for your required credits. So when we think about public health versus clinical health, sometimes students have this question, what will count? And it's sort of broken down here on this slide, population versus individual, health and wellness versus sickness, and promotion, prevention, and protection versus diagnosis and treatment. So clinical health internships will not count for your required internship units. So what does that mean? If you are wanting to accrue a large number of hours shadowing a doctor, a pharmacist, a dentist, a physical therapist, that will not count for your public health internship. You sometimes can do a public health internship at a clinical site, but you are looking at data. You are looking at patient education. You're looking at public health focused activities in a clinical setting. So a clinical setting can work, but clinical work will not fulfill your required internship units. So some students also are wondering why we have a requirement of an internship to graduate. And there's many reasons, but it really includes the faculty and the curriculum prioritizing that you get hands-on experience, that you have an opportunity for practical application of classroom concepts. It will help you clarify your interests within public health and healthcare. A lot of students after their internship will say, I know which direction I want to take my career now, or I've switched the focus of my graduate study program that I want to do. So therefore it helps prepare you for life after graduation, and it will expand your professional network. And also you're just going to have a really interesting and fun time too. So your course options are all students have to earn 6 units of the required internship, HPS 493A. You need those 6 units to graduate. Honors students can enroll in HPS 493H. And if you have already completed your 6 units of required internship, or you're not yet accepted in the professional major, then you can do HPS 493B, which is the elective internship. So as I mentioned, HPS 493A, 6 units are required to graduate. The prerequisites are HPS 350 has been completed, you have public health major status, and you've completed this orientation video and worksheet. And then once you find your internship site, you submit a completed and signed work plan and preceptor agreement, and you also submit a resume for your preceptor. So you submit your preceptor's resume. That's a requirement of our college and our national accrediting body. And you submit all these on the D2L prep course site, and I will look at them and approve them there. So honors students, as I mentioned, can take HPS 493H. It's all the same prerequisite as 493A, plus you need to be enrolled in the honors college. And there is an extra honors assignment once you're doing the internship. And it's the same forms as on the previous slide submitted to me in the D2L site. HPS 493B, which is the elective, so this is not required to graduate. The prerequisites here are HPS 178 has been completed and HPS 200 has been completed. You also need 6 additional public health coursework completed. You also need to complete this orientation video and worksheet, and then just like the other internships, you'll have that completed and signed work plan and preceptor agreement, and you will submit a resume for your preceptor. So that is your preceptor's resume. And again, all these forms are submitted on our D2L prep course site. So how many units should you enroll? How should you break up those units? So the first option is to just do It's 3 units in one semester and 3 units in another semester. So 3 units in spring, and then you continue your second 3 units in summer or fall. You can do this with the same agency, or you can even switch agencies in between those units. The second option is to complete all 6 units in one semester. So that's a heavier lift. You need to have room in your schedule for that. And then the third option is to complete 2 internships for 3 units each at 2 different agencies. So that's a little bit different from option 1, a little bit similar to option 1. So option 1, you're at the same agency for 2 consecutive semesters. Option 3, you're at 2 different agencies in 2 different semesters. So a note on enrollment for spring 2024. You cannot enroll for more than 19 units during your internship semester. And in fact, we really recommend that you take 16 units or fewer during your internship semester. And this is to allow you time to get to and from the internship, to balance the additional work that you're going to have, those hours that you need to have during the business day, those sorts of things. And a note for spring 2024, tuition and fees are assessed for the internship class. Okay, so contact hours. So for 6 units, you're earning 250 contact hours. That's about 17 hours a week. For 3 units, you're earning 125 contact hours. That's about 8.5 hours per week. And you can start counting these hours, so officially recording your contact hours starting the first day of class, if all of your paperwork is completed, on Wednesday, January 10th, and then the last day for hours is Wednesday, May 1st. So here's some advice from students in terms of finding and securing an internship and being successful. Talk to your academic advisor about what semester you should plan to do your internship. Absolutely. Do this if you haven't already. You want to start talking with your advisor to see what kind of flexibility you have. Make sure you know all of the deadlines for paperwork so you can get your internship approved and you can get registered on time. That's right. If you miss that deadline of the first day of classes, you won't be able to do your internship. You'll have to bump it to a later semester. Really consider doing your internship over 2 semesters so you can get a deeper view of the agency work. And it's just a lot easier to balance with your coursework as well. So if you can spread it out over 2 semesters, we do recommend that. A benefit of doing 2 internships is that I now have a larger professional network. So again, this would be over 2 semesters at 2 different agencies, can be a great way to grow and expand that professional network. Because many opportunities come up during your internship, limit your other commitments so that you can take advantage of these cool experiences. Yes, just reinforcing that advice from a previous slide. When planning your other classes, be sure to build in time it takes to get to your internship site. Absolutely. So you cannot count your commute time as your contact hours. So you just want to make sure you've got enough room in your schedule with all your other commitments. So let's go over responsibilities for you, for your internship site supervisor or your preceptor, and for me. So for you, the responsibilities right now are to understand the internship criteria and all the deadlines that you need to meet in order to get that paperwork in on time. It's your responsibility to search for an internship that will be a good fit, to be professional when you're reaching out, to communicate your interests and needs, including that the internship must be public health focused and the requirement for contact hours, to any agencies or preceptors that you're talking to. And then it's your responsibility to complete the college and agency paperwork for enrollment in units. And remember, these forms include a work plan, a preceptor agreement, and a resume for your preceptor. So what are the responsibilities of your site preceptor? This is your on-site internship supervisor. They'll work with you to design and sign off on the required forms. And remember, they'll need to sign those. They will offer mentorship to you. They will answer questions and help you resolve issues. They will discuss issues with me as the internship instructor if that comes up. That's a rare situation, but I'm here. And they will also provide a midterm and a final progress report to you and me, and they will approve the hours that you submit on your activity logs at midterm and final. So what are my responsibilities as the course instructor for the internship? I share opportunities with students about internship sites, including posting on the hub. I review the required paperwork, the work plans, preceptor agreements, and ensure that you have submitted a resume for your preceptor. I communicate to the advising team so that they can get you enrolled for your units. And then I serve as an ongoing contact with you and the preceptor once the internship starts and the semester gets going. And finally, I grade the internship assignments, and I'm the one that assigns a final grade for the internship for HPS 493. So here's some more advice from students. Make a copy of the agency and preceptor responsibilities from the internship manual and give it to your preceptor when you're asking about opportunities or interviewing for a position. And this is just so that the future preceptor has a good idea of what a public health internship requires. Okay, now some tips on finding an internship. So keeping in mind that public health is everywhere, really you can be anywhere with your internship. So again, for online students, you can be looking in your own communities. If you're a main campus student, you may want to try to do something in a different city or state, or we've even had students do internships overseas. So it's really up to you and what's going to work best with your course of study. So the tips to get going here include start looking now. So if you've already been doing this orientation, great, you've got a good start. Hopefully you're doing this early in the fall semester, so you've got time to be looking and just be thinking about what's going to be a good fit, meeting with your advisor, those sorts of things. And then start telling people that you're looking for an internship. So you're informing your network, letting them know you're looking. Somebody, a faculty member, a professor in another class, or another student might have a really good tip for you. And then take advantage of college and university resources. So talk with your academic advisor. If you have a guest speaker in your class and their agency sounds interesting, go and introduce yourself. Ask if they have internships. Read the college and campus announcements, emails that come out on Fridays, and then utilize our online resources, which include the Hub on our MEZCOPH website and Handshake through SECD. So on the Hub, you know how to find that, I assume and hope, on our MEZCOPH website, but it's one of the tabs right at the top. And then you want to go under undergraduate students and undergraduate internship opportunities. And then once you get to that internship opportunities page, they'll be broken out by fall, spring, summer, and ongoing. So you can search through there, see what internships are active, see what internships have happened in the past, and just get an idea for the landscape of internships out there. When you're doing your own searching, and this is especially true for online students who might be looking in their home community, you can go to the Hub and you can find keywords that then you can search in your area. So you might go to the Hub and see that the Tucson or the Southern Arizona Community Food Bank has an internship. And you might think, okay, I'm in Los Angeles, maybe the LA County has a food bank. And so then you'd go and do your keyword search with Los Angeles Community Food Bank. Or maybe you are in Illinois and you want to research if Chicago has any opportunities in their public health department. So then you'd search Chicago Department of Public Health internships. So you can find keywords on the Hub that you can then search in your home community, whether you're an online or a main campus student. A lot of our main campus students will find opportunities on the Hub, and a lot of those are internships that we've had relationships with, so we know that they're great opportunities for students. But students find their own opportunities every semester as well, and we're really excited when that happens too. So Handshake's another great place that you can look for internships. These will not be specifically focused on public health the way they are on our website, but it's a great resource, and I encourage you to play around and explore what you can find there. So don't limit yourself. You do not have to find an internship that's listed on the Hub. You can absolutely search and find your internship for yourself. Students do that every semester, and they find great opportunities by really taking ownership over their internship search. So what kinds of support are available to you? So this is support that's available now while you're searching, and also when you're in the internship itself. So as always, you can take advantage of our fabulous College of Public Health advising team. The Disability Resource Center is a great resource. You can talk with them during your search, and then once you have your internship, they can also be a liaison between you and the internship agency, so the on-site work environment, and they can help make sure that you've got what you need if you're a DRC student. The Dean of Students is also a helpful resource for you. They've got all kinds of general information. Student Success and Retention Innovation is a really good support. And you can find links to campus health, psychological services, CAPS there as well. And then finally, the think tank, which can help not just with support for writing, but also for time management and things like that too. So here's some more advice from students. Don't be afraid to reach out to possible preceptors, even when they're not listed on the Hub. I was able to acquire my internship by simply reaching out to my preceptor and saying, do you have an internship position open? I found a really unique opportunity that I was able to get because I asked that simple question. Absolutely, take ownership and really get out there and see what you can find. Along with that, it does require being brave. So it's 100% okay to make cold calls as first contact. You've got someone's phone number or you meet a speaker, then you follow up with them. You can also do this with a cold email or an inquiry email. And then if you haven't heard anything back, give people a week to respond to you, whether it's a phone call or an email, and then follow up if you haven't heard back in a week. And just re-express your interest, let the person know you're inquiring about a potential internship, and if they don't have anything available, would there be someone else in their agency that they might be able to refer you to? So take advantage of all those opportunities that come your way. You'll also want to practice an elevator speech, which describes who you are, focuses on your skill set that you're bringing both from your experiences in work and volunteering in clubs and classes, and what you can bring to the agency. You want it to be relatively brief, and you want to speak confidently. So do practice this, practice it by yourself, practice it with your friends, so that you feel confident doing that when you meet someone. And remember, the only internship you don't have a shot at is the one you don't seek out. So reaching out, it does not commit you to accepting an internship, but you won't find an internship if you're not putting yourself out there in the first place. So don't stress about it if you're looking at 2 different opportunities. That doesn't mean you have to take either one of them. You just want to be putting yourself out there so that you can see what opportunities might be available to you. You also want to be prepared when you're doing that. So you want to orient the agency and the preceptor to you. That might include sharing a copy of your resume. You want to orient them to public health if they need that. So that's where you could share your definition of public health that you worked on earlier in this video. And you want to share with them about the internship experience. So you can go to, on the D2L Prep course site, there's a copy of the internship manual under content that you can share with them so they can get a sense of the internship. And remember to be professional in all your inquiries and interactions. So more advice from students. Start your internships as soon as you finish this orientation. This is so important. I couldn't agree more. The sooner you start, the more options you will have. Talk to your classmates, friends, parents, mentors, advisors, everyone. You never know who's going to know about a great opportunity for you. Actually practice your elevator speech ahead of time. Absolutely. We want that to feel natural and confident when you're actually doing it. Create a spreadsheet of agencies that you reach out to and or apply to. That's a good way to keep track of what kind of feelers you've put out there and where you might be in that process. Some more advice here. Before doing an interview, review the agency website and think about your answers to common interview questions. Absolutely. You want to have at least some pointers about the agency, some basic information about the agency. So if they ask you a question, what made you interested in interning with us, you'll have a response easily at hand that you can give to them in that interview. Inquire to see if you can shadow current interns or volunteer for a day before committing. Fabulous idea. And send a thank you note or email after the interview or visit. Absolutely. It's pretty standard to send a thank you email at this point. So just letting the person know that you really appreciate the time they took to show you around their agency. More advice. The more times you put yourself out there, the more likely you are to get your dream internship. So know that this is a process of putting yourself out there. And then use Dr. Grunwald and your academic advisors as resources as you start your search. Absolutely. We are here to support you. So how do you get enrolled? As a reminder, I mentioned this earlier, but students cannot register themselves for HPS 493 units. So that means pre-approval is required. So you should use the templates provided on the D2L Public Health Internship Prep course site. Those templates are for the work plan, the preceptor and preceptor agreement, and then remember you need to ask your preceptor for their resume and submit your preceptor's resume when you submit your final paperwork. The internship work plan is completed by you, and it also is completed with your preceptor, so you want to work on that together. It incorporates university-mandated assumption of risk and release and lets you know about that, and it requires your student signature and your preceptor's signature. It also includes a purpose statement, learning objectives, and proposed activities that you'll create with the preceptor. So you want to be specific and ambitious when you're doing that. And this is just a small screenshot of the first page of that work plan. Remember, your work plan and your actual experience will be fulfilling. So they shouldn't be things like coffee runs and filing papers. And it shouldn't feel like it's a burden or just a graduation requirement, but it's a great opportunity to make meaningful contributions to the agency where you're working and to your community. The preceptor agreement is a form that we use to confirm that the preceptor understands the role that they're accepting, that they'll be mentoring you, that they will turn in a few required deliverables, those progress reports, and signing off on the activity log. And remember, this will require your preceptor's signature. And this is what the preceptor agreement looks like, and you'll also find that on the content page of the D2L Internship Prep course site. So what are your due dates for your forms for spring 2024 internships? The internship paperwork deadline is Wednesday, January 10th. Everything needs to be submitted by midnight on that day. So you turn everything in using the D2L Assignments tab on the Public Health Internship Prep page. This is a non-credit course, so it will be on D2L for you there. And our dedicated D2L site for the Internship Prep course site, on the content page, that's where you'll find those forms like the work plan and the preceptor agreement. And you'll also find these slides, and you'll find a draft of the internship manual for the spring. And then on the assignments tab of our prep course site, you will find a Dropbox where you will upload your work plan, your preceptor agreement, and a resume for your preceptor. Note that some agencies have additional requirements, so you're going to want to build in time for this. So it's common for agencies, especially those outside of Arizona, to need an affiliation agreement, and this can take up to 90 days. So if you are looking at an internship for the spring and you're out of state and you think you might need an affiliation agreement, you need to get that started now, really. And by now, because I don't know when you're watching this, I mean September or early October. Your agency also might require a background check, a TB test, or other medical proof of health status. So you just want to make sure you ask those questions so you know what you need to have completed so that you can start your contact hours. Because if you need these before you start your contact hours, then that could delay your start time. So that's why starting your search early allows you all the time you're going to need to get these required forms and steps completed. Some more advice from students. Do not accept an internship if you're not sure about it being a good fit for you. Absolutely. Just because you're offered an internship doesn't mean you have to accept it. Talk to Dr. Grunwald if you aren't sure how to ask for more time to make a decision or decline an internship. I help students with this every semester. There's 1 or 2 students, and I'm happy to help with that. And then know that your preceptor may take time to complete the forms, so start working on them ASAP. That's true. You need to give your preceptor a few days, even a week, to get those forms completed. So I just want to acknowledge that you're learning, which means you don't know everything, that you're human, which means that mistakes can happen, and that I am here to help you strategize. This is all a process. Try and have a growth mindset and know that if bumps in the road come along, you're going to learn a lot from them, and that you have support with me and your advisor and your peers who are also looking to strategize and get through this successfully. So there are graded academic assignments, and that's because federal regulations require an academic component in addition to work experience. And this is really to help you to make sure that there are some checkpoints along the way with us on campus. So in addition to your contact hours, you'll spend about 20 hours working on the internship assignments. These include reports, a LinkedIn profile, an e-portfolio, etc. And once you're enrolled in the class, all of that will be explained. So here's some common questions that students have. Why don't you just assign me to an internship? Well, there's a few reasons, but the most important reason is that every student is unique, and you need to find an internship that's a great fit for you. So you don't actually want me to just choose an internship and assign it to you at random. You want to take charge over that and find something that's going to be a really good fit. Can I get paid? Absolutely. We are always supportive of students who get paid for their internship. You can earn credit and get paid at the same time. Can I do my internship at my regular job? The answer to this is perhaps. So if you are interested in this, I recommend you send me an email and tell me something about the circumstances, because it has to be work that's new and different from the work you're currently doing, and you need a different supervisor. So we can talk about that if you're in that situation. Does my internship need to be in Tucson? Nope, absolutely not. As I already talked about, it can be anywhere. Can I do multiple internships? Yes. As mentioned before, there's a couple options for this. Do internships lead to jobs? I mentioned this at the start of the video, but in case you don't remember, this is absolutely true. Every semester, I have a student or two or three or four, depending on the semester, where the internship leads to a job. Sometimes that's at the internship site, and sometimes that's a community connection that they made through their internship. So yes, this definitely happens, and it's very exciting. And will my internship be valuable and fun? Yes. If you are feeling like your internship is not valuable and fun, reach out to me so we can strategize and problem solve. But students say consistently this is one of their favorite experiences, if not their favorite experience in their entire undergraduate degree. So here are a few required notices. The internship instructor, college, and university are not responsible for any financial obligations, including but not limited to travel, transportation, housing arrangements, medical care for injuries related to the internship experience. So what's your next step? Finish that orientation worksheet and email it to me, and then you'll get access to the non-credit dedicated D2L site, Public Health Internship Prep Course site. If you've got questions, you can email me once you've completed the worksheet and send it to me. We can set up hours by Zoom or video conferencing or phone. And also make sure you rely on that public health undergraduate advising team. They're so amazing. Ashley, Nicole, Abba, and Melanie are there for you. I wish you the best of luck, and I look forward to working with you on your internship.